Welcome to the Explainer. Okay, if you're a leader in health policy, you know that understanding who's shaping global strategy is absolutely critical. Today, we're giving you a strategic briefing on the work of Dr. Indu P.S., a really key figure whose contributions are directly influencing policy, not just internationally, but on the national level too.
We're starting right here with this one appointment because honestly, it speaks volumes. Being a member of the WHO's Strategic Advisory Group of Experts, that's SAGE, means Dr. Indu has a seat at the very table where global vaccine strategies for diseases like dengue are hashed out and decided upon. It's a huge deal.
So, to really get a grip on her influence, we need to go way beyond just a list of titles. What we're going to do is break down her work into three concrete pillars of impact that really define modern public health. Okay, so let's dive into our first pillar, infectious disease policy. This is where you can see her direct influence at the World Health Organization, especially when it comes to the global response to what are called arboviral infections. Viruses spread by insects like mosquitoes.
Now, look at the scope of her influence here. It is really comprehensive. It's not just about one thing. She's shaping the cutting-edge vaccination strategy for dengue, and at the same time, she's helping develop the actual clinical management guidelines for a whole bunch of other major viral threats.
So this begs a really important question for anyone in a policy role, right? What does all this high-level work actually mean on the ground? How does sitting in a WHO working group in Geneva actually translate to policy in your country? And here's the bottom line. Her expertise literally helps write the playbook that nations all over the world adopt. So when your country is putting together its dengue response plan or figuring out a vaccine rollout, that strategy is being shaped by recommendations coming out of groups where she is a key voice.
All right, let's move to our second pillar, and this one is a biggie. We're looking at her leadership on one of the most critical new frontiers in public health, that intersection of mental and physical well-being. This is an area where policy is changing fast. This role as co-chair is just a perfect example of that leadership. By heading up the Global South Advisory Group for a super prestigious Lancet Commission, Dr. Indu is making sure that the unique experiences and health systems of a huge part of the world's population aren't just an afterthought, but are central to the entire conversation. And that brings us to our third pillar. This one connects on-the-ground national research to the global fight against non-communicable diseases. NCDs like heart disease and diabetes. It really shows how vital that local data is for creating health interventions that actually work.
What you're looking at here is that perfect research-to-policy pipeline in action. It starts with a huge study to get a real picture of what people are eating. Then you analyze that data. This isn't just guesswork. It's about generating the hard evidence you need to create smart, targeted policies to fight the rise of NCDs. So the key takeaway here for any policy executive is pretty straightforward. You can't build effective NCD policy on a hunch. It has to be built on this kind of rigorous local research so you actually understand what's driving the disease in your specific population.
Okay, so let's pull all three of these pillars together now. When you look at them side by side, you start to see the full picture. A truly multifaceted leader who is shaping global health policy from every critical angle you can think of. Think of this as your executive summary, the at-a-glance version for your briefing notes. You can see her impact spans the entire spectrum, from infectious diseases at the WHO to integrating mental and physical health with the Lancet, and all the way to driving national NCD policy through solid research. And all of this brings us to one final, and I think really crucial strategic question. What does this all mean? What does a career that looks like this tell us about where global health leadership is and where it's going? In the end, the policy impact of Dr. Indu P.S. isn't just a track record of accomplishments. It's a blueprint for what the future of effective health leadership has to look like. It's comprehensive, it's based on evidence, and, critically, it proves that to solve our most tangled health challenges, we absolutely need expertise that is truly global and representative. So the question for every health leader becomes, are we building the kinds of systems that can empower this kind of leadership everywhere?